Jane is a single mother who loves her only child, Tim. Jane had a rough childhood. As her dad struggled with a heroin addiction, her mom had to provide for the family. She was able to fight through all the difficulties and get into law school. She's a lawyer now with a great paying job. She has a good life, but her job is very stressful. One day, as she was driving to work, another car hit her vehicle from the back. Jane suffered multiple injuries and she had to go through several surgeries. Jane was in a lot of pain, and to reduce the pain, her doctor prescribed her Oxycontin. She was told to take 2 pills a day to reduce the pain. Since Jane is a single mother with no family around her, she had a lot of troubles with taking care of Tim as she was going through the recovery process. She started to take 3 Oxycontin to help with the stress. It just seemed like a reasonable solution. After all, her doctor prescribed the pills. How bad can they be? She gets back to work after 3 weeks, and she's behind on so many different projects, so much paperwork to do, as she's recovering from her injuries. At this point, she is taking 4 Oxycontins a day. The pain of her injuries and the stress of her life just makes everything worse. After a month, she runs out of pills, and her doctor refuses to give her more. She feels really ill. She has nausea and lots of pain. If she can't get a prescription anymore, she has to look elsewhere. After a few hours, she's able to find a drug dealer and get her hands on more pills. She needs to take more and more of the pills just to feel normal. She becomes a user for several months until one day she overdoses at work. She was saved by her colleagues by using naloxone. She was rushed to the hospital after, and that's when she realizes how severe her issue is, and she starts to seek treatment. Unfortunately, this story is not that uncommon. In this video, we will discuss different aspects of opioid use disorder to shed light on this topic.
People have started using opioids for non-medical reasons, and this pool of people has grown rapidly. Current global trends indicate that each year more people die of overdoses, with the majority of them involving opioids. With this increased use of opioids comes catastrophic consequences such as increasing rates of mortality, emergency room visits, and opioid use disorder. The opioid epidemic remains a large issue in society, and drug overdoses have nearly tripled from 1999 to 2014. The greatest non-medical use of opioids is most common in young adults aged 18 to 25. 2 in 3 adults who are treated for opioid use disorder first used opioids when they were younger than 25 years old. It has been found that the brain development of young adults actually contributes to their high risk of addiction and substance-seeking behaviors. Effective strategies do exist to treat opioid use disorder in young adults, which will be touched upon in this video. However, complex barriers exist that inhibit young adults from seeking the treatment that they need, one of them being stigma from peers and society. Stigma is negative attitudes, behaviors, or shared beliefs about people with drug addiction that can manifest in different ways. As mentioned, there is a lot of stigma that prevents people with opioid use disorder from seeking the help that they need. Society typically assigns blame to those with drug addiction, portraying the belief that they have control over their condition and so they are responsible for their behaviors. It has been demonstrated that even healthcare workers commonly have negative attitudes towards individuals with substance use disorder, which can lead to poorer healthcare that they receive. There are also many negative labels attributed to those with drug addiction, such as junkie and addict, that should be completely avoided. All these forms of stigma, whether it be through society or systems, may lead to the individual with drug addiction experiencing self-stigmatization. Self-stigma is when the individual internalizes all the negative feelings that people feel towards those who use drugs and apply it to themselves. This can lead to social anxiety, fear, distress, suicidal thoughts, hopelessness, and act as a barrier for that individual to seek out treatment. Stigma prevents people from receiving the help that they need, so we need to end this stigma through learning about substance use disorders and being aware that it is a medical condition deserving of care like any other, being respectful and changing the way we talk about drug use, not referring to those with drug addiction by negative labels, being open-minded and not letting someone else's opinion or assumptions affect how we see someone.
Many studies have demonstrated that a person's environment and their genetics play a big role in substance abuse. opioid use disorder risk has a large heritable component, from about 23 to 54% to be exact. A study done by Hannock et al. Identified 16 polymorphisms, which are variations within a specific gene. And this gene, called the OPRM1 gene, provides instructions for making a protein called the mu opioid receptor. These variations that affect the mu opioid receptor function or expression could alter the reward pathway and are therefore very strong candidates of affecting opioid use disorder risk. There are other genetic variations that play a role in opioid addiction, and if you would like to read more about the specific genetics, please check out the references in the description of this video. Additionally, one's environment plays a role in opioid use disorder. Significant predictors of opioid dependence include a younger age, unemployment, psychotropic medication use, as well as a history of PTSD, anxiety, depression, alcohol abuse, illicit drug use, trauma exposure, and others. Currently, opioid addiction is treated with the following medications: methadone, buprenorphine, and naloxone, which have proven their effectiveness in treating addicted individuals. And each of them has a little bit of a different effect on different opioid receptors. Most medications for opioid addiction involve the use of an opioid agonist. An opioid agonist binds to the same receptor in the brain that was activated by the drug of abuse, but in a safer and more controlled manner. So an agonist just basically turns on these receptors. These medications can reduce symptoms of withdrawal and reduce cravings, which allow for a more gradual and controlled recovery process, reducing the risk of relapse. The two most common opioid agonist prescriptions that are used are methadone and buprenorphine. Both drugs help reduce cravings and withdrawal symptoms in a person with opioid use disorder without producing euphoria, and patients tend to tolerate it very well. Naloxone is a medication that is given to rapidly reverse an opioid overdose. This drug can quickly restore normal breathing to a person if it has slowed or stopped because of this overdose. Naloxone should be given to any person who shows signs of an opioid overdose or when an overdose is suspected. Naloxone can be given as a nasal spray, or it can be injected into the muscle, under the skin, or into the veins. Naloxone works to reverse an opioid overdose in the body for only 30 to 90 minutes. Therefore, the most important step you can take is to call 911 so the person can receive immediate medical attention. Additionally, therapy has also been shown to help treat those who are struggling with an opioid addiction. For example, a study in 2005 found that those who participated in cognitive behavioral group psychotherapy at the end of the intervention period, which was about 6 months, showed less drug use than the control subjects.